Let's go from the continent to the diaspora, where the biggest South American country, Brazil, continues to be one of the nations most affected by the COVID-19 pandemic. Joining us now to talk about this is Dr. Daniela Gomes, who is from Brazil, but currently is a visiting assistant professor of international studies at Trinity College. Thank you so much for joining me, Dr. Gomes. Considering you're from Brazil, you've probably been following the impact of COVID-19 more closely than many of us here in the States. What cities have been most affected by COVID in Brazil?
Thank you so much for having me, Mark. I have been following the news about what is going on in Brazil, especially because my whole family is back home. And we now have a disparities in the treatment of COVID-19 in the whole country. Of course, larger cities are more affected because of the number of the population, but we have seen even in small towns having to shut down everything because of the number of deaths and the small amount of rooms and space and ICUs at the hospitals.
More than half of Brazilians are of African descent. Black Brazilians have also died from COVID-19 at greater numbers, not different than here in the United States. Why are Black Brazilians the most affected?
For different reasons. According to the Health Association for Family and Community Medicine, what is going on is that, one, of course, we know that Black people are more affected by high-risk diseases such as high blood pressure, diabetes, and that also impersonate more the deadly roles of COVID-19. But also because of lack access to the public health system, where people have like a majority Black population have access to the treatment, they don't have enough tests, enough vaccine, or enough kind of treatment that it would prevent those deaths. So even white people are larger amount of people hospitalized. Black people are the larger amount of people dying from COVID, for those reasons of like late diagnosis, not access to ICUs, and also the impact of poverty and distance from hospitals and centers.
Brazil's Supreme Court formalized a criminal investigation last week into President Jair Bolsonaro's handling, I guess you could say, of the pandemic. It could eventually lead to an impeachment. Many people are not particularly confident that that's going to be the outcome. Can you give us a little more information about that?
Yes, I don't think an impeachment is going to happen. The Congress in Brazil has different kinds of petitions for an impeachment, and nothing happened to this moment. But we cannot talk about a lack of or a low politics related to the COVID-19 by the President Jair Bolsonaro, because he didn't do anything so far. He had 4 health ministries in 1 year since the pandemic started. Every one of those ministers who decided to tell him, hey, you should do this, you should invest in vaccine, he fired. He denied to buy vaccines 11 times from different companies, even the ones that were produced in Brazil. Brazil has one nation health system, free health system, that could provide vaccine for everybody if the vaccine exists. The thing is that because he denies the pandemic, he says the pandemic is not that bad. He says it's just a cold, and he follows pretty much former President Trump book on what the pandemic would be, and not giving that serious. He still invests in what he calls like pre-treatment to COVID, like hydroxychloroquine and other medications that were already proven not effective in COVID-19 treatment because it doesn't exist. So the only thing that exists that would be effective would be the vaccine, and he refuses to buy. So now with the vaccine we had, we vaccinate more than 10% of the Brazilian population, including elders, high-risk populations such as people with diabetes and high blood pressure and other health issues that are more predominant and for risk of COVID, and also populations like first care responders and indigenous population. But because of the statistics of the Black population, that we are not among the elders, we are not among the first care providers like doctors and nurses, the Black population is staying behind in the vaccination as well. And now we are even suffering
Absolutely.
with a lack of
It's actually quite unfortunate. It's actually quite unfortunate how consistent we see this around the world. Two things,
Exactly.
right? One is authoritarian leadership that denies COVID, whether it's Donald Trump, whether it's Narendra Modi in India, whether it's Bolsonaro in Brazil. We see a very similar pattern, and we also see that wherever there are poor people, whenever there are Black people, we tend to be on the wrong side of the equation when it comes to health, prosperity, access, safety, and even healing.